Welcome, Christina. Good to see you. Good to actually see you in person. Great actually to be together at ISPIM Tallinn 2024 and to be part of a refreshed special interest group on healthcare and health and innovation. Something that's particularly close to my heart. I'm sure it is for you as well.
Very much so, yes.
Yeah. So tell me a little bit about your background then.
Okay, my background is kind of multi-phase. I first started out as a clinician,
Right.
and after that I moved into patient monitoring R&D, and then I went into academia. I went and got my PhD at a little bit older age, and now I'm working at the business school, but looking at innovation, so working with innovation management. So I have the practitioner side and also university side as well.
Yeah, it resonates quite nicely actually, because I've been a practitioner, within government now for 20 years. I've spent 10 years as head of innovation, policy and strategy for the health group in Welsh Government. More recently, I've been working on our 2023 innovation strategy for Wales, which has a health and well-being mission, and the practical implementation of that. So I guess I'm coming at it first and foremost from a practical point of view in terms of how can we affect change across health and care. So for me, looking at ways in which we can support practitioners, certainly with people with an interest in health innovation, and how you can scale that to other sectors as well. I started doing a PhD 3 years ago, really enjoyed it, and the PhD is something that brought me to ISPIM. So hopefully, what I'll be able to bring to the group is government knowledge. What that does show is that how we all bring a range of different diverse backgrounds to the group.
And the others in the group do as well. They're not here today, but they have also, I think everybody complements everyone very nicely.
And a really sort of energetic meeting we had to re-kick off the special interest group on healthcare innovation. Great to learn from the experiences of other special interest groups. There's a real opportunity here. There's already people within the ISPIM community who we can tap into to give us really good ideas. My big area of interest is all about how we develop national innovation approaches and how we can affect a change across systems using like an ecosystem approaches for innovation.
Well, there's always technology. Technology is always interesting in advancing technology, but one other part is also sustainability in healthcare, because healthcare, as a provision of healthcare, you get a lot of unwanted stuff, high CO2, high amounts of garbage, so get an understanding of what is out there. And how to do it better. One
of the stats that we talk about actually in the UK is that anywhere between 5 and 10% of all car journeys are somehow associated with the NHS. And it just shows, what a big driver of carbon, what a big driver of emissions, the healthcare system.
We're doing good, but on the side.
Absolutely, yeah. What are the sorts of things do you think we should bring to the SIG?
Well, this is interesting because we discussed this a little bit when we all met. And one thing that we were looking at is what is everybody's strengths and what are the interests, but also somehow uniting the people who are interested in the health and innovation, and getting us all together and seeing as a group also which way we go. Because when you get a group, you get a lot of great ideas together. If you're by yourself, you have your one idea and say, that's a good idea.
I think, so for me, I'd really like to see a whole range of different kind of practical case studies that we've been able to, some of the best ones perhaps that we've all discovered, from within our own networks, within our own countries, that we can bring and we can hold somewhere. Some of the studies that we have access to, some of the big policy documents that we have access to. One of the big things that I'd like to bring to the group is a study I did back in 2021, which is the NHS Wales COVID-19 Innovation and Transformation Study, and we interviewed over 1,000 clinicians, policymakers, managers, doctors, and got their view on what has worked during COVID-19. What are the things? What is the innovation that we've seen? But actually, what are the things that we want to keep, and what are the things that we don't want to keep? Right. And there were lots of both, as you can imagine. So those relevant kind of publications, those studies, I think would be great to kind of build a bit of a body of knowledge on that.
I think that's very important. There's so many people who are studying so many different things,
and
it just stays in academia, but that it actually goes out and is able to do impact.
Oh, absolutely, affecting change out there in whatever system or whatever networks that people work within. I think it would be really good to have a full healthcare track at the next ISPIM conference, probably in 2025.
Two thumbs up.
So on behalf of the Special Interest Group, we'd like to invite people to contact us if you've got ideas for what you think the Healthcare Special Interest Group on innovation can do. If you've got ideas, if you've got suggestions, if you've got things that you'd like to propose, if you've got publications, documents, strategies, whatever, and we'd be really keen to speak to you.